Welcome to Misconceptions, the podcast where we challenge preconceptions, shatter myths, and bring light to the misunderstood world of women's maternal and reproductive mental health. I'm your host, Devorah Enton, a licensed therapist, trained sex therapist, and a specialist in perinatal mental health. This podcast is dedicated to empowering women globally, navigating motherhood, maternal mental health, and reproductive mental health, all through the unique cultural lens of the Jewish woman. We are here to provide you with evidence-based information, whether you're a mother, an aspiring mother, a health professional, or someone intrigued by these complex topics. Today, let's dispel some misconceptions together.
Hi, I'm Devorah Enton. Recently launched the Misconceptions podcast because I felt like there was such an important opportunity to have conversations with women, with Jewish women, with Orthodox Jewish women, but with people in general around topics relating to mental health and topics relating to perinatal mental health, maternal mental health, reproductive mental health. So much is kind of captured in this conversation. So I wanted to just let you know a little bit about who I am. I'm a licensed clinical social worker. I have extra certification in what's called perinatal mental health. It's a more recent development where we can get certified in this kind of care and supportive care. Gives you a sense of the passion that people might have around caring for pregnant people, women, their families throughout their pregnancy, as well as postpartum issues. I also have additional training from the American Society of Reproductive Medicine. We are trained through them in the mental health issues that individuals who seek support or are dealing with issues relating to infertility and pregnancy loss. And then I also have an advanced degree and a postgraduate training in sex therapy through the Council for Relationship. I will very shortly be eligible to sit for ASECT certification, just kind of a standard of care relating to working with individuals and couples and the issues of sexual health. And I have a deep and passionate training and responsibility for those that are dealing with grief related issues. I would say that pretty much my mental health career, once I was dealing with issues in private practice, were really focused on women's health and bereavement issues. So perinatal loss was really kind of my entree into this world. A number of years ago, I trained with the Miss Foundation under the leadership of Dr. Joanne Cacciatore. She's out in Sedona, Arizona, where actually I used to live in Phoenix, and knew about her work and did her first 4-day intensive on compassionate bereavement. And that really has set the tone for the work that I do. I've been a clinical consultant with several organizations. One of them is Knafayim, an organization that focuses on the needs of those that are experiencing any kind of reproductive loss. So a hysterectomy, a stillbirth, miscarriage, etc. And for many years now, I've actually run their support group. I was a clinical consultant with Yesh Tikva on issues relating to infertility and the needs of the community to hopefully change some of the conversation around these very deep and painful matters that relate to women and their spouses, and very often their extended family. And this has always been an area of passion. Even before I was in private practice, I was dealing with this from a macro level, enjoying the opportunity to work in several different Jewish family and children's services in Phoenix and in Philadelphia, where I currently live, to talk about and bring more attention and awareness to issues that impact the Jewish community and the broader community at large. So kind of dealing with this from a macro level perspective of, like, can we put on a conference? Can we bring in education? Can we have a group to talk about these matters? Really kind of at many points in life, it was about all things mental health, but has narrowed with time into things relating to perinatal and maternal mental health issues. So just to give you a sense of the wording of what we're going to be talking about, we are maternal mental health, I would say, is kind of an umbrella of dealing with women's health related issues and the mental health conditions that might go along with them. I think there's kind of dividing that out in two ways, to perinatal mental health being issues of pregnancy and postpartum, and then reproductive mental health issues relating to infertility. And then there's this hybrid kind of crossover between the two of issues that are relating to pregnancy losses, because it obviously falls into the category of perinatal concerns as well as postpartum concerns. And then, of course, the grief work in the middle. And then often it's associated with infertility challenges as well. I think just kind of to set the stage in thinking about some of the things that are involved in coping with and talking about and bringing light to issues of maternal mental health. Anything in pregnancy would be things like dealing with birth traumas, dealing with complicated pregnancies, dealing with issues of hyperemesis, dealing with issues relating to bleeding in pregnancy. What about the mood issues of pregnancy and postpartum, the concerns around postpartum depression, postpartum anxiety, postpartum intrusive thoughts, OCD, psychosis? We're going to be talking about all of those issues and potentially all of those diagnoses and how it impacts individuals and their families and their potential for family growth. In talking about reproductive health issues, we're talking about the difficulty of becoming pregnant, finding out that there's a genetic issue that you carry, finding out that your ovaries are not producing healthy eggs, or the embryos you're attempting to create are not sustained, are not well, are not healthy and sustainable. All of these are questions and conversations that we are going to have around reproductive and maternal mental health issues. Often we will introduce concepts that have are Jewish in nature, are potentially relating to the religious law that many of us follow, how that kind of integrates with the world that we are experiencing and the challenges that are being experienced by individuals and their families. And hopefully it will be a supportive and creative and creative space where we could talk about some of the hard stuff. And I think about kind of the assumptions of the experience of parenthood, of motherhood, of our bodies. So much of the assumption is that everything will go according to how, either according to my plan or according to this more global experience that most women experience. So this assumption of course I'm going to be able to get pregnant. And what does that mean that when I'm not able to? Or of course I can stay pregnant once I got pregnant, that of course that pregnancy will last. And of course I will have a healthy baby. And of course I will love being a new mom or a mom in general. And of course I will, I'm going to know how to do this because, how hard can it really be? And ultimately, I think what we're faced with is the reality that it's not always going according to my plan. And when things fall outside of the realm of what I think or anticipate or expect, how do I cope with that? And where do I turn to for help, for resources, for support, for information? And hopefully this will be one of those spaces that will kind of create that environment where people will know I can get more information around postpartum anxiety. I can get more information around how do I cope with a body that feels uncomfortable for me during pregnancy or after I give birth? And how can I get more information about where I can seek support when I'm going through a loss or a loss after loss or pregnancy after loss? All of these are conversations that we are going to be having. So I hope that you will find us in all the ways that you can find a podcast on YouTube, as well as all the other platforms. Make sure that you tag us and comment, tell us what you like, and let us know, of course, what you'd like to hear more about. You can hear more about me read more about me on my website, devoraentin.com. I think it's important to mention as well that I'm an abuse prevention specialist when it comes to sexual abuse. I've been running a program under the leadership of Jewish Family and Children's Service in Philadelphia, and have been teaching abuse prevention curriculum for the past 9 years. And so it's just kind of one of these other hats that I wear that I feel is a crucial part of the conversation. Perhaps we can throw some of that in to this discussion as well. So I look forward to hearing from you, gathering up listeners, hopefully developing the next generation of people who are more knowledgeable, more empowered, and ultimately more connected and more resourced. And it's going to be a pleasure to have you along for this experience and this journey.
Thank you for joining us in this episode of the Misconceptions podcast as we continue to challenge myths and misconceptions about women's maternal and reproductive health. Remember, knowledge is power, and it's the first step toward understanding and empowerment. If you enjoyed today's episode, please share sensitively with someone you think might benefit. And don't forget to subscribe so you won't miss out on our intriguing topics. Keep questioning, keep learning, and let's continue to dispel these misconceptions together.